If you suffer from headaches despite having tried multiple treatments, then this video is for you. My name is Dr. Sater. I am a headache neurologist and pain doctor in New York and Connecticut, and I see thousands of headache patients every year. In this video, I want to give you 10 tips. You can call them headache hacks, and these are things that I've learned across the years that unfortunately are not taught in textbooks. All right, so let's do this. Tip number 1. If you have pain behind your eye, this is what we call retro-orbital pain. Your tendency might be to assume that pain behind your eye is coming from the eye itself. However, a lot of times this pain is actually what we call referred pain from the neck. So let me show you. If you look at this model right here, and this is your cervical spine, there is a nerve that's called the occipital nerve. You can see it in green right here. And that nerve actually comes from around C2 in the cervical spine, and then it goes toward the back of the head. Now, what's important about this nerve is that it makes connections at the level of the brainstem with the nerve coming from behind the eye, which is called the trigeminal nerve. So because of that trigeminal cervical connection, what ends up happening is that patients who have problems with that nerve or with the cervical spine will get referred pain behind their eye. And that can happen in migraines, it can happen in cluster headaches, it can happen in tension headaches. So don't ignore this. A lot of times it's coming from your neck. And if you or your provider were to press a little bit on that nerve at the back of your head, you're going to feel that it's actually irritated a lot of times. So that's what we call tenderness to palpation over the occipital nerve. And the way to address it is with an occipital nerve block or medication that might actually be targeting this specific nerve. All right, next, if somebody labeled you as tension headaches, I want you to not take it for granted. Now listen, if life is good and your quality of life is good and you're not having headaches or you're getting treated properly, then great. However, if you're still getting headaches and all you have is a diagnosis of tension headaches, then I want you to really question it. Among hundreds of patients that I see who are labeled as tension headache, more often than not, it's not really the right diagnosis. So a lot of the tension headaches that I see who are referred to me by other providers are either migraine or cervicogenic headaches, so headaches coming from the neck. And the reason why this is important and an actual hack is basically that once you label it correctly, so whether it's cervicogenic headaches or migraine, then you're opening the door to the right treatment. So if you're just tension headache, a lot of times the treatment is conservative, over-the-counter medications like Tylenol, NSAIDs. But when we label it correctly as either migraine or as cervicogenic headache, that opens up the possibility for things like botox injections, occipital nerve blocks, the specific medications for migraine. So that's why it's crucial to make sure you have the right diagnosis. So my recommendation is take the diagnosis tension headache with a grain of salt. All right, moving on. Next up, if you have migraines and you have not tried the new CGRP medications yet, then do yourself a favor and try them. Ask your doctor to get a sample and have a conversation with them about the risk and benefit. They're extremely well-tolerated medications. Usually the most common side effect is pretty much nausea in like 2% of patients. They're much better tolerated than the classic migraine medications we used to have, like the tricyclic antidepressants, like amitriptyline, the beta blockers, like propranolol. And the CGRP medications can be used for either rescue or for prevention. And they're available in pill form now. So medications like ubrelvy, Qulipta, nurtec, excellent medications. So if you haven't tried them, try them and ask about them because these just came out in the past 5 years. So if you've had headaches for, let's say, 10, 15 years, you may not even be aware of their existence. And the other thing I will mention is if you try one and it doesn't do the trick for you, don't give up. Try another CGRP. I've seen this a lot. So some patients, for whatever genetic reason, don't respond well, let's say, to nurtec. They don't really get any improvement, right? And then they try ubrelvy and it's life-changing. Or the other way around. Everybody's different. Okay, next up. If you have chronic migraine, which is defined as more than 15 headache days a month, and you haven't tried botox injections or occipital nerve blocks, then do yourself a favor and ask your provider about these options. I have seen a lot of life-changing results with both of these procedures. So the botox procedure is targeting the muscles of the head and neck, like the frontalis, the corrugators, the temporalis, the cervical paraspinals. And so by relaxing the muscles, that decreases tugging on the nerves and decreases pain. The injection is done once every 3 months, and there's more than 60% benefit at the 6 months mark, so just after 2 cycles. And so this is an excellent preventative option for migraine. And the other one is the occipital nerve block, which is a cortisone shot for the nerve that you see in yellow right here. and that's essentially the nerve that is also very highly implicated in headaches. Both are excellent options. There are different indications for each, so talk to your provider to get a better sense of which one is more appropriate for you. All right, next up, if you've already tried so many different options for migraine and none of them are working, then that makes me question whether it's migraines you're dealing with in the first place. And so it's important to get an MRI to rule out the secondary causes of headaches. But essentially, the idea is that there are a lot of different conditions like IIH, which is basically an increased pressure of CSF inside the brain. And then you have obviously the scary things like brain tumors and other headaches. But essentially, if you're not responding to the migraine medications, then that really begs the question, are we really dealing with migraines? And simply trying an additional medication number 6 or number 7 is not necessarily the best approach. It's important to take a step back and just double check that we have the right diagnosis. Next tip that I have for you is basically that it's okay to question your doctors. We're all human. We make mistakes, not often, but we do make mistakes. And as the patient, it's your right to question that what we are doing is the right thing for you. So let's say if you have a doctor and you're diagnosed with migraines and you've tried multiple treatments and you feel that you're still not getting the benefit, it's completely okay to ask for a second opinion or a third opinion or a 10th opinion, whatever that is, until you find the right diagnosis for you and the right treatment options. And I've seen a lot of patients essentially who would refer to me after having been seen by multiple other doctors and they were still getting pain despite all the treatments that were tried. But then we try something different, with a fresh pair of eyes, you have a new look and we might catch something that was missed before. So make sure that you're getting the right medical care and your doctor will understand, because your quality of life matters way more than your doctor's ego. All right, next up, if you have migraines, aim to have one good preventative option and one good rescue option. So that applies to patients who get more than, let's say, 5 headaches in a month, right? So you want to have a good rescue option so that when a headache happens, you can stop it and abort it. But then you also want to have a preventative option to make sure that these headaches don't happen in the first place. Now, for the preventative options, you have a lot. You have the old medications like amitriptyline or triptyline, propranolol, topamax. And then you have the newer options. So that's like nurtec, Qulipta. And then you also have the procedures. So botox, occipital nerve blocks. These are good for prevention too. And then when it comes to rescue, you have obviously the over-the-counters like Excedrin, but then you also have the prescriptions like triptans, and then you have the CGRPs like nurtec and ubrelvy. So the ideal scenario is that you want to have one good rescue option, one good preventative option. And it might take a few tries until you find the right one for each of the 2 categories, but when you do, your life will change. All right, next up, I see a lot of patients who are referred to me and they say that they've tried botox and they failed, and they've tried occipital nerve blocks, for example, and they failed. And then when I ask a little more, it turns out that the procedure wasn't really done right. For example, when it comes to occipital nerve blocks, most people do them at the level of the scalp, which is really where the nerve ends. And that can be fine for some disorders, like for migraine. But for a lot of other disorders, like let's say if it's a cervicogenic headache, then the procedure needs to be done in the neck, where the nerve originates and where the problem is. And just because you had a given procedure, let's say occipital nerve block in this case, it doesn't mean it was done correctly. So you need to make sure to ask your provider and to tell your provider how it was done. And potentially it might take more than one try with different providers to make sure that you're getting the right procedure. So don't really discount that. I've seen a lot of patients who are in the same boat. They've tried, let's say, botox with a different provider and they had no benefit. But then they're, let's say, referred to me or to a colleague, and then we try the procedure the right way, and then all of a sudden they have no headaches, right? So, don't take for granted that everybody is doing things right, especially when the stakes are high, right? Because it can really change how many headaches you're having in a month and your overall quality of life. The same applies to medications. So a lot of times patients will tell me that they've tried, let's say, Topamax and failed it in the past. But then I ask a little more about what dose, and then it turns out that they only tried 25 milligrams. But then let's say we go up on the dose to 50 or 75 or 100 if it's tolerated without side effects, and all of a sudden the headaches are gone. So just remember that. With a lot of medications, the effect is going to be dose dependent. All right, next up, pay attention to your triggers. So a lot of times it's easier to prevent a headache than to treat it. So if you keep a headache diary, whether it's in an actual, handwritten form or on an app or whatever you want, basically you'll be able to identify what specific foods or other items might be triggers for you. For some people that could be dark chocolate, for other people it could be red wine, for other people it could be coffee, right? Everybody's different. For some people, it might be stress, it might be sleep deprivation, it might be your period. There's a lot of different things, right? But if you don't keep track, you're not going to be able to know what the pattern is. But once you do, you'll be able to know and prevent these headaches. Okay, next up, you're allowed to have more than one type of headache. So just because you have migraines does not mean that that's going to be the only type of headache you have. I routinely see patients who have more than one type of headache. Now, some of them are attuned to it and they know their body pretty well, and they might tell me, I feel that, one day I have a headache that's all over my head, but other days I have headache that's only on the left side and behind my eye. And they kind of know that there's a difference between the two. But other patients may not be as self-conscious, and they might kind of assume that all headaches are coming from the same cause. So it's important to keep that in mind. You're allowed to have more than one kind of headache. It could be that you have migraines, let's say 5 days a month, but then other days you might have headaches coming from your neck, or cluster headaches, or IIH due to high pressure. So especially if you feel that the treatment that you're getting does not really work for all the headaches, and it seems to depend on the day or the kind of headache, then it could be you have more than two diagnoses, and that's fine. But it's important to identify them so that you're getting the treatment for both and not just one. All right, and then finally, I want to tell you a bit more about triptans. So the way triptans work is by action on the blood vessels. So they actually lead to changes in the diameter of the blood vessels that are inside the brain. And that is thought to be the reason why, essentially by clamping down those vessels, they decrease the inflammatory mediators that are coming to trigger the migraine. Now, the important thing is that for the triptans, if they are used at the beginning of the headache, so the very first half an hour to an hour, they work pretty well. And a lot of patients know this and they like them for that reason. And that's because they have clamped down the vessel. And so now the inflammatory mediators are not going to come and trigger the headache. However, if you take them, let's say 3-4 hours after the headache has started, and they may not be effective at all for some people. And that's because by that time, the vessels have already flushed all the inflammatory mediators, and so it's too late, even if you clamp down the vessels. So it's important, if you do take triptans in addition to other rescue medications, time it appropriately. So if you know that the headache started in the past half an hour or an hour, then great, take your triptan. But if you, let's say, woke up in the morning and we don't know when the headache started, it could be that it started 5 hours ago during sleep, and then in that case, you might be better off taking a CGRP. All right, I hope you enjoyed this, and I hope you found at least one of these useful. Comment below if that's the case. Tell me which one of these hacks was the most useful specifically for you, and if you have any other tips or hacks you want to share with other people who suffer from headaches, then go for it. Have a good one.